This webinar series is co-organized by AKT Health, TAMP, and the AI World Society. You'll see here AIWS, co-founded by our good friends Tuan Nagayan and former Massachusetts Governor Michael Dukakis. And they have been a great support to us in this webinar series. So thank you very much. Good morning. Again, good afternoon, good evening. Thank you everyone for joining us today. We will be recording and have the recording on YouTube. So I ask you to please stay muted until our Q&A at the end. We'll have the audience Q&A the last 10 minutes. So we will have our keynote speaker, then we will have the insightful dialogue with each of the three Dr. Innovators. And then finally, again, the last 10 minutes will be open to Q&A. So feel free to, at any time, you could write your questions in the chat and I will read them, or at the end, you can raise your hand or you can come in to ask your question. So please, please stay muted unless you at the end, when you have a question, you can jump in. I leave it unlocked. So up until now, have not had any issues. So I'll go ahead and introduce our keynote speaker, Dr. Dhini. Her background is internationally trained medical doctor with AI research experience in global health technology. She's led AI initiatives at Babylon Health and the Texas Medical Center and Texas Medical Center Innovation. Co-founder of Paradox, developed AI-driven chronic disease management platforms for Medicare-focused primary care organizations, and a former AI researcher at Babylon Health, contributing to AI tools like symptom checkers, health assessments, and digital twins. Dr. Dhini Nasution. The topic is accelerating AI adoption, empowering physicians for the future of healthcare. I hope did I get the pronunciation of your last name correct?
Dhini Nasution. Yes.
Okay,
correct.
good.
Thank you.
All right, wonderful. The floor is open, so please feel free to share your slides. I keep it open, and begin when you are ready. So again, we ask everyone to please stay muted. I don't have you locked out, so please stay muted during the talk. Thank you.
I don't see the share screen option here.
Oh, you should have at the bottom middle. Mine is a green button. I know each way going back from Teams to Zoom. I know I'm on Teams, and I'm kind of lost in there. So
okay, can everyone see my screen?
Yes, we can see all slides. And now, that was, you were going full screen down there. Yeah, right there. Is it?
Yes.
Yes, there we go. Okay, you're on full screen. Thank you.
Okay. Good morning, everyone. Good afternoon. I think good evening, perhaps for some people. I've just prepared a few simple decks to just address a few questions that I got before this event. Happy to be here, and hopefully my experience can help in any way. So my topic today is actually how to accelerate the AI adoption, because it is one of the biggest challenges in healthcare right now. So let me just get started to it. Mostly, I'm just gonna talk mostly about how AI because right now I'm very focused on industry, that AI can actually reduce our workload as doctors, and of course, and assist us to improve decision-making capabilities. and what are the practical strategies that I've been experiencing or seen in my work experience, and lessons learned on how to accelerate AI integration in healthcare. Briefly about me before I really start. So during the Texas Medical Innovations, the focus is to execute idea to just execute idea. And of course, because I'm focusedly right now in the US market, so a lot of these are probably more related to the US healthcare system, all of my experience and everything. So one of the really good questions that I got is actually, how do we bring AI innovation to reality? This is a big lessons in my career, is that first, whatever idea you have, you're gonna have to start really small and get really specific. And what I mean by that is you have to really articulate well what is exactly the problem you are solving, and whose problem is that. And obviously the ideal is to have a pilot program so that you can get real data, not using available public data that typically very clean already, and it doesn't reflect the real data that you're gonna get when you scale and get into industry, when you try to implement it in in other hospitals, or like really want to get real world feedback. And of course, collaboration is key. If you can get some AI developers, data scientists for sure, because AI is very much dependent on data and the user, whether it's the doctors, the nurse, or the admin, or every stakeholders that actually want to use your innovation. I would always recommend to use existing AI platforms instead of creating one from scratch, because we have so many amazing AI models right now. Some are free, open source, or you can use big company like Jon Snow that very specific into healthcare. You can play around with it. You can just put your data there and create your own AI model for your specific use case, a lot of that. And most importantly, obviously, you have to measure the impact. I mean, is your innovation, your idea, has any real impact, whether it's time saving or more accuracy in diagnosis or treatment or whatever that is. You have to really measure the impact. I think this is kind of like the practical advice I could share to people who wants to execute their idea, because at the end of the day, innovation needs investment, and investment needs a business model. And business model is, of course, again, like whose problem are you actually solving, and is that person, organization willing to pay for for solution to their problem. Again, and this is another question that I really like, is like AI solutions for low middle income countries. I really like AI for triage. This is the Babylon Health that I contribute in building the symptom checkers, the health assessment, because the idea is AI triage is you can implement that in emergency setting. So we can prioritize patients, which one do we should treat first. So it's really about efficiency and managing the whole emergency department. And obviously data entry automation is also very cheap. You can just download a lot of AI powered app to just, when you talk with your patients, it just automatically put it into your notes, whatever EMR you use. If you don't use electronic medical EMR, there's also ways around it to use those kind of AI script. Of course, remote monitoring is also very affordable for low income countries, because everyone basically has a cell phone right now, and AI-driven mobile health to track their health, to manage their health, especially in chronic disease management. This is, I just quote the questions here. What unique strategies can we employ to ensure that AI solutions are user-friendly and seamlessly integrated into existing clinical workflow? This is a really challenging question, is because it is one of the biggest hurdles in AI adoption. Is in reality, a lot of these hospitals, even in the US, the big one, they don't have the right infrastructure to integrate AI into their systems. So the hospital itself have to spend, usually millions to have it ready. They have to have an IT team, data team, security team, and also whoever brings in the AI, whether it's the vendor or startups, whoever it is, they also have to have enough resources to actually make sure everything goes smoothly and they not interfere with the native workflow of that hospital or clinic. So it's a lot of, in my experience, it usually took like 2-3 months to actually learn the hospitals or the clinics workflow. So no one is get interrupted, and making sure that the data is very secure. And a lot of questions will be like, what are you gonna do with the data? Where do you keep it? How do you secure it? Is it de-identify? All of that. And it has to be user-centered design. Again, this is kind of like whatever innovation you're trying to implement in the hospital, it's kind of like, yeah, you have to answer like who's used this AI tools. Is it the surgeon? Is it the doctors? Is it the nurse? Is it the staff? And make sure it's actually doesn't interfere too much with their existing workflow. Otherwise, they won't use it. In the US, of course, it's about integration with EMR, and it is very challenging because every EMR behave differently. So you're gonna have a person or a team that can actually accelerate the integration time really slow, really fast. Typically, it probably takes like 2 weeks. That's kind of like ideal. If it's and it depends like how friendly the EMR company is. And then, of course, the training and support to get confident is because I do heard a lot from MD Anderson, Houston Methodist here in the US, that a lot of these doctors, the surgeon, when the hospital actually have buy a really expensive AI solution, a lot of these doctors kind of shy away in using it because they don't understand how AI actually work. So when they don't understand the AI itself, they don't understand where's the data is actually used in training this AI. They just get less confident and they're not using it. So I always support like, yeah, doctors need a lot of AI training, not necessarily to use the tools, but like really understand what is exactly AI, what is AI can and cannot do. And of course, feedback loops really important. You'll be surprised what the feedbacks that your user or your customers basically gonna criticize your innovation. And this is another question that I really like. Basically the question that I like, the most impacting obstacle that I have faced in my experience, and the best advice I could give is, I think it's about AI is mostly about data. Getting a really good quality data is very challenging, and even when you get the raw data, the challenge is going to be for the data engineer to actually cleanse it and model it, and it has to be consistent so that your AI, have a really high accuracy. And there's a lot of bias in there. And you have to make sure that it's really diverse, and you just have to keep iterate, validate your AI model regularly, like every few thousand stations, maybe. It depends where you implement it. And then data security and privacy for sure. There's like a SOC 2 high trust if you have the money to get those. Otherwise, GDPR, HIPAA, and just make sure everything is secure in the cloud. If you use cloud, or if you use a local server, well, you have to have a team to handle everything. And yeah, financial constraints. I do understand a lot of people. Oh, I have time's up already. Oh, good question. Sorry. And financial constraints, I always say, like, you can get government grants, NGOs, and of course venture capital to fund your innovations. And government regulations, I think government's kind of like behind AI right now. I'm not sure elsewhere. I know the Europe has a more established regulations around the government, but not here in the US. So I guess it really depends on which country you are actually now. And I don't think it's really hindering any innovation. If I'm being honest, it's more about, well, if you just can prove what you do with the data and how you secure it, I think it should be fine. And it's, of course, in AI in healthcare, everything is about safety. Safety first, and then the rest will follow. I think I'm done with my slide. I'm not sure. Hello.
Okay, thank you very much. Very
Yes,
insightful indeed.
thank you.
Yes,
I'm
time
sorry
is
if
a
I
bit
talk too
short.
fast.
No,
Yeah.
we got a lot to cover. We want to hear the dialogue as well. But yeah, there's very practical, very again the real life experiences, and that's what this is about. So thank you very much. Let's move to our dialogue with our doctor innovators. We call in-depth dialogue. We have 3 doctor innovators. Again, we have dozens of certified doctor innovators around the world. We have selected 3. We'll begin with Dr. Barbara Machado in Brazil. I'll let you go ahead and read Dr. Machado's background, wonderful background and experience as the dialogue begins in the interest of time. Dr. Machado, please begin with your question.
Good morning, everyone. And thanks a lot, Dr. Dhini, for the fantastic presentation. And I saw the questions there and I saw the answers. So thank you very much. It's just for practical reasons. I'm just going to tell a small story and make a question. So in my PhD, I needed to prove that a treatment would provide benefits in a micrometer scale. So I had to buy, it was on a skin surface. I was supposed to buy those 3D cameras, which were very expensive. And I had to buy one because otherwise I could not prove my theory. And when I tried to develop an idea that would use this digital data that was obtained from the photos to give me that information, however, people said that if I came up with this idea, it would be pretty much expensive and I had to postpone it and to develop it later. So this is the reason that I pose that questions. It's quite disappointing when you think that you have a good idea, but people do not put their bet on that. And I like that you said that we have to begin small, get specific, get collaboration, which is quite hard, especially because you must trust that everyone will embrace your project with the same passion that you have. And sometimes you don't find people doing like that, especially because in the beginning there is no income. So how was it for you to come up with an idea, develop it, prove that it worked, start using it, and then you went to the market and found, you just found someone that trusted that idea and could pay the price. How was it for you, and how long did that process take so that we cannot give up? We should not give up.
Well, yes, thank you for the question. So yeah, in my experience, the biggest challenge, as I guess every scientist, researcher, is when you get the feedback that who's going to buy your solution? Because if you want to invent something, it's better be worth the money, right? So. And then I learned that you have to really do a lot of due diligence on the business problem. Are you solving any business problem? So like, I'm just gonna use my own example. So with our AI driven chronic disease management platform, we are solving in 2 ways. One, we are saving a lot of time for the doctors, and not only the doctors, but only the nurse, every stakeholders involved in taking care of this patient. And those times actually translate to reimbursement or incentives for the hospitals or the clinic. So we have to calculate everything that down to the dollars and basically say like, well, to innovate these AI tools, it cost me, let's say, $1,000. And I would say, if I sell this to 10 clinic, I would, with $2,000, I get, return of investment. And the investor will ask, how long does it take for you to get a return of investment? Is it 2 years? Is it 10 years and everything? And you have to have like a clear roadmap, not only for your innovation, but also how you're gonna penetrate the market and basically get as much customers as possible. So you have to have a real clear roadmap for the business and for the innovation that you have in mind, and really articulate it well to your investors, and just basically get that trust from them, and basically say like, yeah, I did my due diligence. It's not on the science, because they do understand the science, but the question is like, how do you bring science and to business? That's, I think, a lot of frustration in scientists and researchers, that the industry wants something that actually solves problem. And when I say problem, is like, is it a big enough problem to be solved? Like, how many people are having this problem? Who are those people? And do they have the buying power? And if it's too expensive, you have to figure out a way how to make it less expensive. And how many customers do you need to get return of investment? If you say 10, okay, how long does it take to get 10 customers? Is it a year? Is it 2 years? So a lot of it is actually about finance and business, if you really want to bring your innovation out there. I mean, that's just, I mean, I guess for me right now, I kind of like make peace with it. You can have like the most great idea in the world, but if it's not solving anyone's problem, and no one will, willing to pay for it, and no one will invest, and the idea is just going to stay there in the archive. So yeah, but you have to really make sure, get outside and ask people like, hey, and never, I think my biggest lesson is actually never mention your idea first. So because we get bias, and we actually instill bias on the other person, whoever that is we talk to. It's more about having that conversation and really ask like, hey, let's say in our case, because it's for chronic disease management for doctors, we say like, hey, how are you currently, how are you managing chronic conditions? Like, can you walk me through your workflow? And then you understand who are the people that involve, and then you kind of ask like, if the existing solution already work for them, they maybe not, you probably invent something that nobody wants. It's kind of like a nice to have, and no one's want to buy or invest a nice to have. I hope it makes sense, because
Yeah,
it is a, yeah.
especially about, in the part that you say about the impact. So it is pretty much clear. And I have one final question about the clinical trials, because it was not clear for me yet if you think that AI will really suppress the clinical trials, because one of the main hindrances that we have is that clinical trials are costly, and sometimes they just say, okay, if I do a clinical trial with the product that you want to develop, it's going to take like 5 up to 10 years so the product can go to the market. And so they don't want, this is what you really put it clearly, they don't have the interest in doing that, because they don't want to waste their time with something that they are not sure that it will work within 5 to 10 years. Medicine is changing every day in a fast way. So how do you think that this AI could reduce this time, especially related to clinical trials?
Based on my, I don't have much experience in clinical trials, but based on my own understanding of AI, first, yes, AI can definitely help in patient recruitment and the data analysis for it. It can optimize the trial design for sure. It can predict patient response, and analyze a huge data set a lot faster. It can predict drug dose or treatment efficacy, but safety, AI cannot do that. Clinical validation, AI also cannot do that. At least for now, I don't see it's going to happen anytime soon that AI can assess safety and clinical validation and all of the safety checks. So I don't think I am a big believer that AI gonna empower us and makes everything a lot more efficient and faster. It's never gonna replace anything, especially like clinical trials. I've met with a lot of startups that do clinical trials where AI is really helping is to get a more diverse participant. You can get like global participant and better manage them globally. I think that's the best. I like when people use AI to do that because it's kind of make our data our treatment less biased because you have so many diverse patients in the clinical trials and people who actually need it also. So yeah, I don't think it's actually gonna replace anything anytime soon. But yeah, it's really helpful. A lot of these startups actually create a really nice trial design using AI, but they do have, it's just to optimize it though. It cannot design it for you from scratch because AI is very dependent on the data. So if you use like old model, old data, well, it's gonna be a so-so result. You kind of have to improve the data itself. So yeah, I think that's kind of like my opinion on AI for clinical trials.
Thank you very much, Dr. Dhini. Thank you.
You're most welcome. Thank you.
Yeah.
Excellent dialogue. Thank you very much. In the interest of time, let's move on to Dr. Ibukun Ogundele. And again, I will have you ask you to read Dr. Ogundele's wonderful background experiences as the dialogue begins. Please, Dr. Ogundele, your question.
Yeah, thank you very much, Professor David. Good day, everyone. Glad to be here with you all. And thank you very much, Dr. Dhini, for that insightful presentation. And I must say that you have a very impressive CV. And I hope to be like you when I grow up. So,
Thank you.
I particularly have a lot of interest in how to bring AI into reality. And one of the things you mentioned, which I liked, was starting small and being specific. But in the area of collaboration, I'm someone who is practicing in a low middle income country. And we know that AI, for one to really have a lot of relevance, you have to have something that has a global reach. So now my question is how do I position myself in a way that I would get the trust of potential collaborators? Like I've seen that you've moved from different continents in your career. So what are the key ingredients I need in my CV to be able to attract potential collaborators, to gain their trust, for them to be able to know that as a scientist, I have something to offer in the world of AI? Thank you.
I think that one of the best, if not also the easiest way, is to publish your research. I think I did that too. Find a place where it's internationally. It doesn't have to be like the fancy journal. It could be anything that is actually international, so people globally can read it. That's actually one good way to do it. You have to publish your research. It doesn't have to be like a really serious research that you do. If you can do that, even better. If not, like a simple white paper or case studies also work. Just publishing is actually one of the easiest and I think the best way to kind of showcase to the global audience. And leverage community. There's a lot of open source community that you can join. And then you'll be surprised how many people are actually really open to collaborate and really get excited to learn about you and everything. Yeah, I mean, I like all the community. Even as simple as, let's say, Reddit. Maybe it's a younger crowd, but they do like really smart people that very open with ideas and innovation, and we're more than happy to give you feedback and criticism. I mean, there's a lot of it, like especially if you go to open source, like in AI, I think Hugging Face. I don't know if you're familiar with that. I mean, there's so many. I have nothing on top of my head right now. I Hugging Face. There's also John's deep learning community. That's the one of the good one from Andrew Ng. And the more you just do it, the more people actually you know, and you get exposure from them as well. And of course, a lot of this free course. I always do the Andrew Ng course. He just released I think 4 free courses, and their community is really active. There's a bunch of data scientists, data engineer, AI people there, and especially people that get AI in healthcare, because Andrew Ng is the pioneer, I would say. So yeah, I would say, join a lot of those community and then share everything publicly. That would be, those are the things I actually did too in my career. Yeah.
All right. Yeah. Thank you very much for that. But I also want to ask, in terms of academic qualifications, I'm a surgeon. I have my fellowship in pediatric surgery. So I'm thinking, doing a master's or a PhD, is it something very, very important, or just having a number of certificates in different aspects of AI? Like I have some from TAMP and that.
I'm sorry, what was the question again?
Yeah, so do I necessarily need to have a PhD or master's in AI to be more relevant?
No, not necessarily. I don't know. I think AI is more about applying skills, because to have like a degree in AI, you kind of have to be like a hardcore math person. Certification is enough. There's a lot of, especially if you go to Coursera, there's a lot of AI in healthcare. If you want to take one, I took the AI for machine learning for healthcare. There's a lot of math in there, but it's actually really helpful to understand how AI for imaging. It's kind of like the basic. So that's really good. Stanford has a lot of course as well. I think that's enough. You don't necessarily want to take a master's degree for AI, because if you took master route or any degree in AI, it means you have to learn you learn a lot of math, which is, if you like math, of course, like, just do it. I mean, more education is better. But I personally think, as doctors, our strength is actually on the healthcare knowledge, not the AI. The AI people actually need us to make them, to make sure that their AI, it's not come from a very technical perspective. It has to be balanced with the clinical perspective. That's one of the issues in innovation right now. A lot of these new ideas is invented by people that have no healthcare experience, and then they get confused why no one want to use it. Well, they don't have any healthcare professional in their team in the first place. So the strength is actually in the clinical knowledge. And if you have a bit of AI, I think the AI should be more on the applied AI, not how to build an AI. So I would suggest, I think MIT actually has an open source of MedSpace if you want to play around. I like Jon Snow a lot if you want to test how to apply like refining and tuning AI model to your use case. And I know Jon Snow has like 2 weeks free. If you want to use it, you can request for like up to a whole month. The difference is with Jon Snow, it is designed for user friendly, individual user. So you can go in there, you can call their staff and help you to set it up, everything. And then they will walk you through with all of their existing AI model. Basically, they have the NLP, they have the LLM. They have so many models. You can just pick which one do you want to use. And they have a lot of team. You can just call whenever you have issues while you try and play around and creating. I think that's kind of hands-on experience would be really helpful. Yeah, I think that's I like Jon Snow a lot. I know. Yeah, Jon Snow I think is one of the best out there. If any doctors want to try, what is actually applying AI, what is actually AI model? How do how do we actually do it? Jon Snow would be. I think it's not too advanced for even for anyone that doesn't have any AI background at all.
All right, thank you very much. I've taken notes. I'll definitely look into a number of these things you've mentioned. I have a few other questions, but because of our time, I will just ask one other one. AI, obstacles to AI in terms of our government regulations. We have a peculiarity that we don't even have some very formal regulations in our region. I know in some other countries, some of those regulations are strict. They make it difficult to bring some of these tools into reality. So I'm just thinking, rather than we having pockets of individuals trying to overcome these regulations, have you or other innovators in this field thought about having some global regulation framework? Like we have existing WHO, UNICEF, and the likes regulating healthcare on a global scale. Have we also thought about developing some global regulation framework for AI in healthcare? And if not, what are the things we can begin to do as stakeholders to get this to happen?
A lot of conversation around that, but I think it's really I like the idea of having it global regulation, but I think because every country have a very different response, I would say, to innovation. So I think more it's kind of like, well, you kind of have to define what do you mean with regulate, what part of AI do you want to regulate. I do like a lot when people try to tackle the AI ethics, because it's kind of like about what is ethical and not ethical in AI, because AI is, if you're not careful with the data privacy, you're basically exposing your patient data, and it could be dangerous. And I mean, I would just say, like, there's this really cool AI solution that basically can identify patient that has a very severe disease. So usually at that stage it's the treatment is not to cure it anymore, but it's more to kind of like make it very comfort for the patient. So there's this AI that can actually identify those patients. And then that AI would suggest to the doctors, like, hey, maybe have a conversation about advanced care planning, basically like refusing to be CPR and whatnot. So that's kind of like, from my home country, Indonesia, that's very culturally inappropriate to do that, because it's kind of like, so that's kind of like what kind of, so maybe that kind of AI solution would not be successful in a country like Indonesia. It's because it's very culturally, Indonesian would say that's very unethical. When someone really old, really sick, and you say like, hey, can we stop taking care of you, basically, right? Because it costs a lot of money. Why don't we send you home and just make sure you're comfy and whatnot, and just hopefully you pass away peacefully. But here in countries like United States, people don't mind that kind of AI, so I think it's more about, so it's really challenging to create like a global regulation for AI, because I don't think we even have the same definition about what is it that we want to regulate. Every country is very different from one to another. And yeah, but I do believe in creating guardrails of AI. And I think AI for healthcare, I think more importantly about it's not asking can we do it, but should we do it? If because there's a lot of very sensitive area, gray area around healthcare. I don't know. I mean, I don't have like a strong answer to that, but a lot of people here, my colleague, we are more about what is ethical, what is unethical, AI in healthcare. And everyone wants to share data, but then who actually owns the data? Is it the patients? Is it the hospital? Is it the innovator? Who owns the data? Even if you de-identify it, should we put it decentralized using blockchain? There's a lot of questions that we don't know the answer yet. But yeah, I think give it a few more years, maybe we'll know better, I guess. I don't know. It's a
Excellent.
really tough questions to answer. Yeah.
Yeah,
Thank you
no,
very
you
much.
did a wonderful job. Thank you. Thank you both. In the interest of time, let's move. Yeah, I shared some of the links as well in the chat. We'll share some of the other links later as well. Let's move, please, to Dr. Ademola Agbaje in Nigeria, and I'll let you read his prestigious background as well as Dr. Agbaje asks his question. Please.
Thank you very much, David. Dr. Dhini, well done.
Thank
I've
you.
gone through your body of work. I've listened to your keynote. Really impressive body of work, to be honest. I'm particularly captivated by your symptom checker chat box. It seems to me like a low-hanging fruit, especially for places with busy clinics, which we tend to have in this part of the world. And that looks to me like something that, can be really practicable and can give immediate results in terms of helping to decongest the clinic or even reducing the number of people that come to the clinics in the first place. Again, I've listened to what you've got to say about the ethical barriers around use of AI and all of that. I know that's an ongoing conversation. It was actually one of the things I intended to ask. But in the interest of time, I'd just like to find out from you, what are some other solutions that you think, what are some easy and practicable things that we can apply AI to in our own environment, lower and middle income countries? Like I mentioned earlier, we have issues with congestion of our clinics, our patients, the ratio of healthcare worker to our patients is not, is subpar, to say the least. So what are some of easy, quick solutions, that can be quite practicable in our environment that we can quickly action and then see results in no time? And why that is important is that apart from the fact that it solves an immediate problem, it also serves as a gateway drug, if you will. It serves as, a conversation starter, for other solutions to come on board, which may be a bit more complex than those other ones being solved at the moment. Thank you.
Thank you for the question. I think the affordable, low cost, and easy to implement is a mobile app. There's a lot of AI that if you want to, you can. I mean, it's very easy nowadays to create. You find a student, fresh graduate, they can easily create an app. And there's a lot of existing AI model that can easily be integrate into the AI. I work with a lot of students, fresh graduate, that they're just very quickly build something for me, like a prototype. It's really easy. It's very affordable as well. If you want to play around, there's called, I think, Bubble. You can create your own app there. But yeah, and I really like the idea of the symptom checker. It is really helpful for patients to actually basically create the sense of urgency, because usually symptom checkers, because we cannot, I'm not sure, well, we cannot say it's a diagnose, because what we like to say is actually it's just kind of like a suggestion. So it's not like a standing alone, solid diagnosis. It's just like a suggestion. You may have, let's say, you may have hay fever, And I could easily say, like, you don't need to see a doctor, just rest, or maybe, that's kind of like what I built also before. So it's really navigating patient, is your symptoms serious or not? So they know, like, oh, I don't need to go see a doctor. I don't need to walk 8 kilometers to see my doctor. So it's really helpful. And even if it's not an app, there's actually a lot of really a good website that the patient can just log in and use it as a symptom checker. And a lot of them are actually free. I don't remember the name of it. There's actually a few that's already been built. But if you want to build your own, it's actually quite easy. The challenge is going to be, because a lot of these solutions are built in English. So it's culturally appropriate for Western people. The challenge will be how do you localize it? And localize means it has to be able to dual language. So you have to translate everything, the symptoms, the diagnosis, and everything to your own local language. And we do know, as doctors, people describe their symptoms using different words. The same words could mean a different meaning. It depends on the culture. So how do I put it? So like in our case, because Babylon is global, it's not just in UK, but also like in Arabs, Hong Kong, and everyone. So we localize everything, so it's become culturally appropriate. So for countries like Indonesia at that time, when the AI asks about sexual disease, none of the patient will answer it. They just keep saying they give the main symptom, but they don't give the explanation because it's taboo, very taboo. Even to a robot, the patient somehow, most of the patient doesn't want to answer. So expect things like that. So the challenge will be to make it culturally appropriate so that patient will actually use it. And a lot of it's kind of like localized in a way, like the patient should understand when the AI asks, are you having dizziness or headache? It's actually two different things, right? I'm not sure what is the local language, of course, but in Indonesia, we have a specific language to describe dizzy and to describe headache. So that will make the diagnosis even more accurate. That's kind of like the challenge. So yeah, I mean, it's very affordable, it's low cost, it doesn't take a lot of time. There's a lot of existing AI models you can just easily implement quickly on your phone or on the patient phone. The challenge will be on the localizing it. We're probably going to take a few months, maybe six months to localize it, to translate everything into your local language and to give it more vocabulary. So the patient has more options when they want to talk or type their symptoms, as to make sure the diagnosis that is suggested by the AI is accurate. I'll be more than happy to share with you later on about what is localization and what you can do about it. Just feel free to reach out to me, and then I'll send you some resources if you want to try to do it.
Thank you, Dr. Dhini. I'll be taking you up on that offer.
Yeah.
One last thing before, one last thing before I go is just to ask an ethical question. I mean, from your body of work, all of your experience in AI, if you were to, make a prediction, to look into what the future looks like, how likely is it that the responsibilities of the scientist can be separated, or let me put it in terms of the liability of the scientist can be separated from that of the AI? Is it likely that AI will assume an identity and take liability for things just for AI alone? Because what I currently see is that some of the liabilities still lie with the deciding physician. Is it likely that at some point in the future, the buck will stop at the table of the AI and AI alone? Thank you very much.
Oh, well, thank you for that question. I literally just had that conversation yesterday. I think one of he's a really great venture capital person that met with a lot of big companies. And I think I like what he's suggesting is that for any AI out there, if to make sure that it doesn't have any liability and whatnot, whoever invent that AI should have to share the algorithm so everyone can see what algorithm you use, show us the data that you train it on. So if let's say the company doesn't want to share their algorithm and whatnot, so it's safe to assume that it has a lot of liability. And when that happens, it's not the physician anymore. It's going to become whatever company that has that AI model. But if that company willingly publicly share their algorithm and show it to the rest of the world, like this is how our AI model actually works, this is the data we use, and then the liability becomes on the user. And that's why the training, the education for the user is really important, because what we want is actually you can trust the AI, but do not rely on it. Because AI is not perfect. You know, AI it's built with our own data, and our data is very biased. And the more we use it, people would assume the AI gets smarter, but that's actually not true. The more you use it, the AI are actually getting dumber. So unless you have to have human in the loop in the background that actually check the AI model from time to time and tweak it here and there, because AI, you can't leave AI alone. If you build an AI and then you implement it and then you think you can leave it alone, like it doesn't work like that. Once it's implemented in the real world, every few times you have to check and make sure is the AI still accurate or not. You kind of have to fine tune it from time to time, because the more you use it, the data is going to be very different from whatever data you use to train it in the first place or to validate it. So you have to keep validate it over and over again. So yeah, again, like if the AI willing to share the algorithm, the liability becomes on whoever using it. If they don't want to share it, the liability stays in the company. I think it's really fair. I'm not sure how everyone here follow with the TikTok drama here in the States. It's because TikTok refused to show the US the algorithm. If they actually willingly share the algorithm and we know how TikTok actually works, then the liability becomes to the whoever used TikTok. But because they refuse to share it, now it become liable. If you don't want to share it, why, right? So that's kind of like that's why this TikTok drama, I would say it's really interesting, because it's kind of like, yeah, if there's nothing, liable in your algorithm, share it with us. Because even if you share it, it's not easy to duplicate. It doesn't work like that. You can just share it. No one can actually copy it. So yeah, I think that's kind of like my response to that.
Wonderful.
Thank you very much.
Fascinating. Thank you both very much. Wonderful, fascinating dialogue. Let's move to our Q&A. If you have not written your question in the chat, please do so or raise your hand. I see we have a question from Dr. Al-Husona in Iraq. Can we have an established AI module that can be patient-friendly with an interface that the patient can upload, say, a short summary about his or her problem before arriving at the healthcare facility?
I'm sorry, David, can you repeat the questions one more?
Yeah, sure. Can we have an established AI module that can be patient-friendly interface, and the patient could upload, say, a short history about their problem before arriving for their appointment?
Oh, we definitely can. Well, a lot of AI app actually can do that really, really good. Patient have a account. it's either typing it or or upload their lab results or not. We definitely can do that. It's very easy to use, and I think right now we have so many options of apps that can do that. Yeah.
Okay, thank you. We can share later if we have specific. We can share that with the group. Dr. Charles Ekpenyang has a question. I have concerns regarding the ability of AI to protect a subject's data from another AI. What do you suggest?
Well, I'm not sure what it means, like um from another AI. Like if you can elaborate on that, what does that mean? Because right now, the data is supposedly really secure in the cloud.
It could be, right? I'm guessing here, there's the question of, quantum computing, cracking, AI encryption. So I'm wondering, maybe you can explain, Dr. Ekman, you're saying maybe one AI, cracking, hacking into another AI, maybe one AI is smarter, it's maybe hacking into another AI. This could be potentially, I think, what the question is getting at.
Well, I'm not aware if anyone built an AI to, hack data. Because usually when we're talking about security, it's actually a person that just, spend hours in front of the computer and try to hack the system, whether it's finance, healthcare, or anything else. Yeah, I don't think it's not like, so it doesn't work like you can install a virus. It doesn't work like that. If let's say there's a virus and whatnot, it's not necessarily gonna take the AI. It's actually wherever you storage your data. If you storage your data in the cloud, let's say AWS or Azure or Google, wherever you want to store it, it will affect the storage. So not actually the AI, if that makes sense.
Okay, yes, does. Thank you. And we have another question here. As you mentioned earlier, there's a lot of open source places, discussion forums, things like that. But how would someone protect their idea? This question comes up a lot. I know it's kind of the different schools of thought on that. What's your opinion on telling your idea to everyone?
I think I would just say, like, maybe not, I know this is not nice to hear, but whatever idea you may have, trust me, everyone else probably have the same idea as well. That's one thing. And again, the challenge is not having that really cool idea. It is actually how to execute that idea into reality, and executing idea into a reality is really hard to duplicate or to copy, even if you share it to the whole world. So I wouldn't be worried so much about sharing your idea, because I think I actually encourage to share your idea, because you'll be surprised to hear suddenly someone say like, oh, someone already did that. Or maybe like, hey, I like your idea. I share the vision with you. I can help and I can contribute. An idea evolve. The more you do your research, the more you actually hands-on on it and go out to the real world, your idea will evolve, and you'll be surprised how much it's going to change. The core will stay the same, but the idea probably going to adapt or evolve dependent on the demand or the problem you're trying to solve. So I would say, no, don't worry about that, because yeah, I mean, you can give it a try, share your idea. Maybe I'm sure you have like a lot of idea. Just pick one and share it. You'll be surprised. Someone will say like, hey, I have that idea, or hey, someone else are doing that same idea as yours, or maybe very similar. So yeah.
Thank you. Thank you very much. Another question, Dr. Segar, from Dr. Segar, what's the potential, or is there a potential for misdiagnosis and errors?
Oh yeah, of course. There's definitely a chance for that. That's why what if you're building an AI for healthcare, first thing that really important is safety first. So we really care about safety first and then the accuracy. So that's why in UK or in the US, legally you're not allowed to say the AI able to diagnose. What you can say is actually AI able to suggest. It's all about suggestion and to make the other person, the user, aware of it. Typically it would say this suggestion is powered by AI, so the user understand that there's no human doctor behind it. So it's more kind of like so it serves more like information that the user can take or can leave. So to mitigate the safety, because it has to be safety first, because it can definitely be wrong.
Okay, excellent. Thank you.
Mm-hmm.
How easy is it to build? And a couple more questions coming in with that. How easy is it to build an AI model that can work offline and maybe work on frequent periodic updates?
Well, a lot of existing AI model actually you can install in your laptop and you can use it offline without internet. But of course, you need to, from time to time, connect it online to make sure you get the best model and whatnot. To make, update. It's just kind of like updating your software. That's basically, fundamentally it work. So yeah, you can actually, if you have a good laptop, you can just install it in your laptop and it will be offline. And
Yeah,
I
great.
wouldn't say don't try to build your own AI model. There's like, AI scholar that do that for us. Thank God. So it's free if you want to use it. Just install the existing model and then iterate, use it specifically for your use case, and then yes, you can have it offline for sure.
Okay, excellent. We'll share more of those sources as mentioned later. Yeah, I had GPT walk me through my local install, so it did pretty good job. So yes, thank you very much, Dr. Dhini Nasution, and all of our Dr. Innovators in our audience. Wonderful question, wonderful dialogue. We look forward to seeing you again October 5th, same time, same place. We'll send out the links. We'll send out reminders. We'll have AI influencer, Dr. Philippe Jerwell. Thank you very much, everyone.
Yes. Thank you so much, everyone.
Morning, day, evening.
Thank you.
Bye-bye. Bye-bye. 3D printing and blockchain, XR, extended reality, including virtual mixed reality, artificial intelligence, machine learning. IoT is Internet of Things or Internet of Medical Things, IoMT. These are wearables, 3D printing, and blockchain now coming into healthcare, life science, pharma, all the way through the supply chain, from clinical trials, from patient recruitment, all the way through to clinical trials, and in healthcare for privacy, safety, security, decision-making support, things like that. So we have about 3 minutes. So thank you again, everyone, for joining us. My name is David Hall. So this